While people are looking to that change, calls continue for the end of rotational attendance of schools. The Gauteng Premier, the DA, many experts and even the Basic Education Minister Angie Motshekga herself believe that schools should return to normal. During a briefing on Tuesday, Motshekga said her department had no choice though but to comply with the protocols of COVID-19 that are still in place. Schools reopened across 5 provinces this week. To discuss, we're joined by pediatric nephrologist at the Red Cross Children's Hospital at the University of Cape Town. That's Professor Mignon McCulloch. Professor, thank you for being with us. Do you believe that kids should be allowed to mingle again at schools, which of course means that the distance required between them, the social distancing rules, have to be dropped?
Thank you very much for having me on your show, and I also represent the South African Pediatric Association. And boy, it's difficult, isn't it? We've just come out of Christmas and the summer holiday, where we've seen people on the beach, in parks and everywhere just mingling and not having much social distancing at all. We're very lucky, it's summer, so it's not too cold and we can have a lot of ventilation. But our advice is that we really need to get these kids back to school at all ages. Otherwise, we're going to have a lost generation. And what we are advising is, let's be sensible about it. Let's stay calm. We've just heard from your previous interviewee that the COVID wave in South Africa is beginning to decrease, so that's really encouraging. What's really vital is that we get as many people vaccinated as possible. So really important to get your teachers fully vaccinated, and also parents as much as possible, but most specifically now also the teenagers, because the teenagers are now allowed to be vaccinated. They're allowed 2 vaccines, which is something we've really encouraged, and they are behaving much more like adults. But we also know that the teenagers want to hang out with each other, they want to see their friends, they want to get back to as normal a life as possible. And so if these people are vaccinated, both the teachers and the scholars, from the age of 12 upwards, we can then relax a little bit about the social distancing if you are in a classroom where you may have 40 or 50 learners in one room.
Yeah.
As I mentioned earlier, open air, open those windows, open the doors so that there's good ventilation, and get everybody to wear a mask. So that's our kind of recommendation. Sorry, I interrupted you.
No, I understand that. I guess I want to push you a little bit and say, given where we are right now, 40% of adults, only 40% are vaccinated. And the fact is that many of our schools cannot handle the social distancing and have full attendance. We know that. We can't build new schools overnight. So given where South Africa is right now, what do you think the government should do?
So I think the government needs to continue to encourage vaccination. So that is something we mustn't stop doing. We must continue encouraging vaccination. We heard earlier that it may be because of the summer holidays, but now that we're going back to a more structured environment, both for the parents as well as the scholars, let's continue to vaccinate. Let's get everybody back to school, because we know school is not just about learning, but it's about nutrition. Sorry, excuse me. It's also about getting kids off the streets so that they don't get involved in car accidents, and also about safety, both psychological and physical safety. We need to get kids back to school, ideally on a daily basis. Rotational learning really doesn't work. And we need to try and be as sensible as possible. So get everybody to wear a mask, open those windows, let's get some ventilation going, but really to continue to encourage vaccination as well.
All right, I saw a quote today from an epidemiologist who says the decision to continue with rotational learning is no longer about children's safety, but rather it's a protection shield for those who are not vaccinated. Let's start with the first part of that, children's safety. By now there's a lot of evidence around children. Are they generally safe? And I'd like you maybe to touch on the reports that very young children recently have in fact been impacted by Omicron.
So we've looked very carefully at that, and what we've seen is, you are right, many more children have had Omicron compared to the previous waves. But I also work in intensive care unit, and we've actually looked around the country. We've had very few children in the intensive care unit being ventilated like we saw early on in the pandemic with adults. So we've definitely not had rows and rows of children. We've had more children, but many of them have been what we call incidental. They've fallen off their bicycle, they've been needing to have a hernia operation, tonsillectomy, and they need testing so that they can go for their surgery. And it just turns out that they actually have Omicron as well. So we know that a lot of the kids have been affected, but very few have been critically ill. So that's really good news for us. And what's really important is to get these kids back into a school environment. So some other countries have started vaccinating the 5 to 11-year-olds, and I suspect we will follow that example in time, but we are still encouraging people to be vaccinated. I think there's no doubt about that. And school teachers who feel anxious should be vaccinated. Teenagers often have said to the parents, please can they be vaccinated, and they have a right to do so. They actually don't need their permission. But often we've said, let's discuss it with your parents, with your carers, and let's get as many people vaccinated. Let's get you back to school. Please wear your masks, and South Africans are really great at wearing masks compared to some of the other countries. And let's get education rolling again, because this is now the 3rd year. This may carry on for another year or two, and it may become like the normal flu virus. So important to get our kids back into learning. It's really vital for their future careers.
Thank you for bringing up the flu argument, because I'd love to know what you think as an expert about the commentary or the talk that COVID-19 is starting to behave like the flu, considering that the death toll is very low, that those hospitalizations, like you said, are actually very low. Is it fair enough to say that's happening amongst children already, or is that underplaying the disease?
No, I mean, I think we can't underplay the disease too much, but we also need to start getting on with normal living. And so we've actually said, we've actually made recommendations that we don't think that everybody should be isolating for 10 days anymore if you've had a contact and if you're completely asymptomatic. We are really going to do our economy harm and our schools harm. And so we actually, in the beginning, recommended. A lot of the other countries overseas are saying if you are vaccinated, maybe you only need to isolate for 5 days. And if you're completely asymptomatic and you wear your mask responsibly, maybe you can go back to work earlier. So I think we need to look at our country and say we are very lucky in South Africa in that we've got access to the vaccines. If you look at the rest of Africa, many of the countries are feeling pretty frustrated because they don't have access to vaccines. So we do. Get the kids back to school, get the parents back to working, and don't have the situation where you may spend 10 days, then have another contact, another 10 days, then you're off for another 10 days. So you could almost be off for a month without any going back to work. So it's time to be sensible. It's time to be pragmatic. Let's protect everybody with vaccines. Wear our masks. Be responsible. If you're not feeling well, then don't walk around without a mask. But it's time to get kids back into school. Daily school, get them advancing from all years. We're not just the early learning, but right the way through to matric, because we have a whole generation of kids who potentially have their futures at stake. And as I said, it's not just about learning, but it's about nutrition, physical, sexual safety, and most importantly, mental safety.
Yes.
Because kids want to see their mates, they want to be chatting to them, they want to see that they're okay and that they're not actually suffering from severe illness as well. And the kids haven't been suffering.
Thank you so much, Professor. Really appreciate your time. Professor Mignon McCulloch, pediatric nephrologist at the Red Cross Children's Hospital. I finally got that right. All right, let's